And some of you know me and some of you don't, but my name is Jerry Still. I am president of the Lehigh Valley Military Affairs Council. We have with us today, of course, two of the founders, Bill Harris and Nate Klein. On this Veterans Day, I wish to thank each of you for coming to hear about the latest progress and the potential future of our healthcare in our community initiative, which formally involves an alliance of 6 hospital networks in the Lehigh Valley area: Coordinated Health, Easton Hospital, Good Shepherd Rehabilitation Hospital, Sacred Heart Hospital, St. Luke's Hospital, or St. Luke's University Health Network, and Lehigh Valley Health Network. I'm trying to get these names straight. Sometimes I don't always work, but thank you for being here. A day such as this is meant to celebrate the service of our military veterans, past and present, for they have helped to make the United States of America both strong and resilient. I am privileged to lead local veterans and non-veterans who work to achieve the Lehigh Valley Military Affairs Council mission of improving the lives of our area's military service members, veterans, and their families by fostering and coordinating the support of businesses, organizations, institutions, and communities. We do more than promote awareness of the military's role in defending America. Our vision statement calls for the Lehigh Valley to become the most supportive community in America for them, and we're doing that quite well. Today, with your assistance, we embark on a path of exploring an appropriate concept for veterans-centered medical home, built upon the foundation stones of military veteran screening and identification at patient reception points and targeted military veteran-centric clinician education. We have already begun to implement this. This is no small task. Meanwhile, over the past year, several other hospital networks not in the Lehigh Valley have decided to associate themselves with our effort. The seed of this idea was planted in 2011 and is now growing very quickly. They are Grandview Health, Lancaster General Health, and Pocono Medical Center, representing Bucks, Lancaster, and Monroe counties. Therefore, we have gathered today veteran advocacy liaison officers, VALOs as we call them, from these hospitals, and members of the military and veterans community we serve. Representatives from the Department of Defense and National Guard are also present. Importantly, we now have presence and support from the Hospital and Health System Association of Pennsylvania, representing hospital networks throughout the state of Pennsylvania. HealthNet Federal Services, which administers the Department of Defense healthcare program in the area, and some of the Department of Veterans Affairs, the Steptoe Group. It's a premier medical education contractor to the Department of Defense. There are others also involved. As I said, this effort is growing quickly, and with your help, it's going to grow even faster than we thought. They have some exciting announcements which will reinforce these efforts, and I'm going to call on Eric Johnson at this point to introduce the speakers. Eric?
Thank you, Major General Still, and happy Veterans Day to you all. I am honored to stand here today to celebrate with our community our coalition's sustained efforts and impact on the health and well-being of our military men and women. As an Air Force Medical Service Corps officer and as a wounded Operation Enduring Freedom veteran, this effort is particularly important to me. Our coalition launched 3 years ago on November 9th, 2011. Since then, it has succeeded in sustaining and expanding beyond the alliance of all the original regional hospitals, as shared by Major General Still. The alliance now includes these 10 hospitals, representing 5 counties and growing. The coalition's Veterans Advocacy Liaison Officers, or VALOs as we call them, representing each hospital and healthcare system at monthly meetings, standardized veteran patient screening and identification processes last Veterans Day in 2013, a process that is crucial to ensuring that our veterans receive the best possible care tailored to their unique cultural experiences and at times complex medical backgrounds. Combined with provider clinical education on veteran and military-centric medicine, the screening and identification process poises each coalition member hospital to be best positioned to receive veterans and coordinate their care across health systems under the emerging VA Purchase Care Program. I'd like to invite my co-chair, Lieutenant Colonel retired Alexander Alex, to come to the podium. Prior to Colonel Alex's retirement from the Air Force, he served as the Reserve Health Benefits Consultant for the Air Force Reserve Command, Chief of Operations for the Medical Support Division. He provided TRICARE policy, program guidance, and advised senior level officers, Department of Defense agencies, Office of the Air Force Surgeon General, Assistant Secretary of Defense, Office for Reserve Affairs, and Congressional Senate and Armed Services committees affecting access to health benefits. Lieutenant Colonel Alex did it all. So before we recognize our other speakers, I'd like to invite our project co-chair to come to the podium.
Thank you, Major Johnson. I did not do it all myself. I had help, and lots of it. Ladies and gentlemen, as co-chair of the Healthcare in Our Community Task Force, I thank you all for being here to celebrate with us today and to participate in these important announcements. Our formula for success rests squarely on the hard work and dedication of our veteran advocacy liaison officers from each of our coalition partners. Without their skill, expertise, and determination in their respective health networks, we would not be standing here today. Each of them represents the lifeblood of this task force and the ongoing commitment on the part of their respective organizations for all veterans and their families. I'd like to take a moment to acknowledge each individual, their organization, and to openly thank them for their hard work and ongoing support. From Coordinated Health, we have Florence Trout. Florence, please stay. Thank you. From Easton Hospital, we have Kathy Weston. Kathy, in the back of the room. Thank you. Good Shepherd Rehabilitation Hospital, Cynthia Bauer. Lehigh Valley Health Network, Judy Sabino. Sacred Heart Hospital would be Peter Schweier. And St. Louis University Health Network, last but not least, Belgian Mission. These folks make it happen for us. And while Eric and I perhaps have the ability to sit at the chairs, the success is centered around these people and their ability to execute inside their organizations. And that takes skill. Thank you all.
And so without further ado, our key speakers for today, we will begin with Dr. Michael J. Consuelos, who we are so thankful to have here from Harrisburg. In July of 2014, Dr. Consuelos assumed the position of Senior Vice President for Clinical Integration for the Hospital and Health System Association of Pennsylvania. Dr. Consuelos will be working with HAP and its member hospital and health system leaders to promote innovative ways of improving healthcare delivery. This will include working with HAP to engage physician leaders, support hospital and health system leaders in developing new payment models, improve quality and clinical care, and support integration of care across this continuum. We are so thankful for HAP's partnership and advocacy in veteran health care across the great state of Pennsylvania. So I'd like to introduce Dr. Consuelos.
Good afternoon and happy Veterans Day to all the veterans in the room. As a physician and as a veteran and a former Army physician, I want to commend the Lehigh Valley Military Affairs Council, the region's hospitals and health systems for the great work they have done on this topic. And this innovation and collaborative effort really is important so that our veterans receive appropriate and timely health care in our region. The vision for a veteran-centric medical home is truly innovative. As I stand up here in my role for the Hospital Association, we try to move the ball down the field for what is now a new healthcare environment. And the team that is in this room is doing the same thing for our veterans and our communities, which is very, very important. There's really no better way for HAP and its member hospitals and health systems to continue to improve the lives of veterans and through this type of effort, and also to reassure the families at home. This project really can serve as a model for other hospitals across the state. Again, a patient-centered medical home is something that many of us are familiar with, and this version, to really make it attuned to the needs of veterans, is a great next step. Hopefully this model will be successful in other hospitals because it does many, many important things that some of us take for granted as we receive our care. It will hopefully have better health coverage and regular sources for primary care for our veterans, will improve their health status, and decrease any disparities in outcomes for their health. As someone who has served in the military, I know firsthand what it's like to treat families and active military members and how important their health is. It's not just the health to go back to their home, but to continue to serve the community. So for that reason, I commend this group, and I have committed our resources within the Hospital Association to help promote and expand this effort across the Commonwealth. Thank you very much.
Thank you, Dr. Consuelos. We will now hear from Mr. Jim Jones, who is the Director of Provider Network Development for Health Net Federal Services, who traveled a great distance here from the District of Columbia. Mr. Jones.
Thank you, Eric, and happy Veterans Day to everyone. Thank you for being here. On behalf of Health Net Federal Services, we are very pleased to work with the Coalition and its members hospitals to help expand the care to our veteran population and also to our TRICARE population on active duty. We have been working with the Coalition actively for about a year in terms of the contracting efforts and expanding the care and the efforts, the initiatives, the things that are going on within the healthcare of this area. And that is really important as we look to initiatives that are going to be expanded beyond the traditional walls of the hospital and things that are going beyond this community to other areas of Pennsylvania. HealthNet will continue to provide resources and our expertise in working with the military population to support that mission. So again, thank you for all your efforts, all the BALOs. We really appreciate it. Thank you.
Thank you, Mr. Jones. We will now hear from Mr. Braham Jay Steptoe, Chairman and CEO of the Steptoe Group, also traveling here from our nation's capital. Steptoe Group works diligently on a variety of efforts in warrior-centric military training to both military and non-military healthcare professionals. He's also traveling with Dr. Evelyn Lewis, also a veteran like himself, the Chief Medical Officer for the Steptoe Group. So without further ado, Mr. Steptoe.
Thank you very much. Appreciate it. Thank you. Appreciate it.
Again, a good Veterans Day to all. Over the past year, veterans and military health and healthcare delivery has gained unprecedented national attention. The majority, if not all, of the nation's civilian and private healthcare systems are currently serving veterans, but more importantly, and there's a noted expectation that many will be increasing their service and expanding their services to veterans based on the recent events with the Department of Veteran Affairs. It is critical to also note that only 26.8% of our nation's veterans are actually registered with the VA for healthcare services. Thus, over 70% of our veterans are actually being seen in the community for healthcare. With nearly 22 million veterans in the United States, if we account for their family members of at least 2 immediate family members, plus the 3 million active duty service members, plus at least 2 of their immediate family members, we're talking about 75 million Americans that have been impacted by war and or service to this nation. That's 1/4 of the U.S. population. 1 out of 4 patients are impacted by military service. Pennsylvania specifically has over 953,000 veterans When we account for their family members again, included, that's 2.8 million Pennsylvanians that have been connected via service to this country. Since military affiliation and following questions are not currently standardized intake questions for the electronic medical record, many of the nation's private healthcare systems are not accounting for military affiliation and connectivity with veterans and their families. This creates a very unique challenge when it comes to warrior-centric approaches, specifically related to awareness, training, education, screening, diagnosis, and management. Similar capability gaps also exist with organizations such as TRICARE and now the new Veterans Affairs Choice Accountability Act of 2014, and the beneficiaries that will be participating in those programs. Again, there are capability gaps within our healthcare systems and understanding of veterans. Lehigh Valley Military Affairs Council is demonstrating exemplary regional, but most importantly, national leadership in its innovative and community-based approach to ensuring that warrior-centric platforms are implemented locally that will improve and sustain high-quality health care and supportive services delivery for the veteran and military population. The Steptoe Group is extremely excited, very pleased, and more importantly, committed to partnering with the Lehigh Valley Military Affairs Council to improve health care and supportive services for the vested interest of our nation's service members, veterans, retirees, and their families.